My name is Kenesha Atkins, and this is my grandmother, Jeanette Younger. She watched me as I was a young child, and I thought that she was my mother. Unfortunately, at the age of 5, she was diagnosed with the disease that ended up taking her life. This really impacted our family, and she was a great loss. And due to her death, it fueled my passion for my career as becoming a doctor. When I grew older, I learned that my grandmother passed away from cancer. And while in undergrad, not wanting to wait until I got my medical degree, I decided to go into cancer research at University of Maryland School of Medicine. I was a part of the tumor immunotherapy lab where we engineered T cells to specifically target tumor cells of each individual patient. A couple of years later, in 2016, just a couple of months after I got married, I lost my aunt to ovarian cancer. This was just 3 short years of her being diagnosed. Because I was older, I was able to really see the decline that cancer has on a patient. Not only physically, but financially, emotionally, and spiritually. It was extremely hard seeing my aunt decline over the years because of her health. And also because her husband passed away from cancer years before, she was left with carrying the financial load of her treatment, which forced her, after being terminally ill, she still had to go to work to make financial needs. And I heard her tell my mother that she did not want my mom paying any of her debt once she passes away. To see this within my own family and to see the financial struggles that my aunt had to battle in addition to her health, it was extremely difficult to watch. In the US, African Americans have the highest death rate and lowest survival rate of any racial or ethnic group for most cancers. This was documented by the American Cancer Society in 2019. African Americans face multiple barriers that prevent them from gaining quality health care. Physical barriers, because a lot of African Americans have lower socioeconomic status and they do not have access to medical care. But then you also have the mental barriers that go along with a lot of African Americans, such as fear, denial, and embarrassment. Again, I seen all of this within my aunt, and she was actually embarrassed to tell people that she had cancer because she felt that she was too young and that it should not have happened to her. Reports have shown within the African American community that the church plays a pivotal role in their medical treatment. Shockingly, I found out that African Americans that attend church are more likely to listen to their pastor on medical advice than their own physician. I had the privilege over 5 years of working with local churches and volunteering in their cancer support ministry and ending in me leading some of the ministries within the cancer support ministry. During this time, I was able to learn a lot of the challenges and the problems that cancer patients face that they are willing to share with me that I didn't find out when they were in the hospital. Problems such as their transportation to treatments. Some individuals don't have any family in the area and are unable to make treatments because they don't have any transportation. They're too sick to drive themselves, and they don't have any personnel to transport them. Other challenges, just like my aunt, were financial. It is extremely expensive to gain treatment for cancer. The radiation, the chemotherapy, it can weigh a lot on a person's financial burden. And this is also something I experienced with my aunt. Something that I've been doing, I have been using my social media as a platform to reach African Americans that do not go to church, to try to educate them and prevent the fear aspect of the barriers that can be combated by education. I am also happy to announce that I have recently become a member of the Cancer Collaborative for Maryland, and this is a program that's set up to reduce the Maryland cancer rates by collaborating with individuals or organizations. Here, we have access to multiple resources that's provided by them that I also plan to use on my social media platform. And also, excitingly, we have a say in the cancer plan that's going to be made for the 2020-2024. My dream ultimately is to open up a hospital that tailors to the underserved for cancer patients, and for them to not have to worry about any financial obligations for their treatments. I would love to model the St. Jude model, but instead of children, for adults. Because, again, African Americans or any underserved population should not have higher death rates just because of lack of information or resources. Thank you.